All right, welcome to the Actions on Claims Overpayments webinar. My name is Tom Ryan, and I will be your presenter today. Today, I'm joined by Mary Muko. She's going to help monitor that chat, take any questions or anything that you have within that. My goal for the Actions on Overpayments webinar is to look at the information that you sent in via questions and pre-submitted to make sure we get everything covered, and then to help you throughout whatever I can as we get through the information. I do want to let you know that we did have some questions asked about Medicare Advantage plans or Part C plans. We will not be covering those today. This is a traditional Medicare or a fee-for-service Medicare or a Medicare Part A and B class, and that's what we're going to focus on. Now, Medicare Advantage plans can create overpayments because they didn't send information correctly or something was paid, and then we found out that someone has an Advantage plan. But we're not going to cover anything on the overpayment plan itself, or I'm sorry, on the Medicare Advantage plans itself. Let's do a little housekeeping. First, if you did not have the presentation, you're welcome to download that. It is available on our training center in the live events page. You can download that anytime today into tomorrow morning. Now, at some point tomorrow morning, and it could even be really early in the morning, it'll be removed. At that point, you must wait. We're going to add this recording back onto the website in the Encore presentation page. Now, a couple people did ask, and I think you're new to Medicare, so I want to make sure that you see this page and you're aware of how to get this, because there was a couple of people that did ask for that. So the first thing I'm going to do is to bring up our website. Our website is wpsgha.com. We're going to go to the training center. Now, if you notice, this is on the very top of the website in the center. When we open the training center, the live events is the first item in the body on the left. It's going to be one of the first boxes. Go ahead and open that up. If you scroll down, you'll see this is our second class of the day. So you can see Actions on Claims Overpayment. The webinar material link is what you're looking for. Okay, if after we remove it and we post it into the Encore presentation, you'll be able to go to the training center and then Encore presentations, which is the middle box in the top row. You will see all of them listed. Now, this one's obviously not listed yet, but if you open the dropdown, and this is the key, open the dropdown, the follow-up document is the presentation. The follow-up document is the presentation. So that's how you're going to find that. Hopefully that does help you. If you have questions, let us know. We'll talk more about that. If you do have questions, we will be taking those in chat. We'll stop at various points to see if you do have any questions. We were informed earlier that we were unable to take questions in chat. We'll apologize for that. I will give you a way to send in questions at the end should you have them. So after this event, we would like you to take a survey. The survey does help us know how we did. Now, by we, I'm gauging whether or not WPS is doing an overall good job. That'll be question one. And then you're going to get into the information directly for this event. So you also get to gauge the event. But I would like all of those different pieces of information to help us understand what we could improve on or what I could do better. A couple of basic disclaimers. The material for this information is current as of today. I did check it. Everything looks good. There's any real changes. That was one of the questions that I wanted to address right away when we talk about this disclaimer and current material. Yes, Medicare has changed. However, the overpayment process has not changed, and there weren't any recent changes to that process. So if you're attending for the sole purpose of finding out what's changed, there isn't any changes. We are doing this based on general questions that we got, which means that we're going to answer those questions based on the information given in the question. It's the best that we can do, and we'll talk more about that as we get through. Also, you want to make sure you use the CMS website to determine if everything is current, accurate, any of that. We do ask that you do not record this program. We are recording it. I've already explained that. We'll post that as an Encore presentation. CMS does prohibit anyone from recording this presentation for a profit-making purpose. Because we don't know how you're going to use the recording, we just simply ask that you don't do it. What are we here to talk about today? Well, first, we're here to talk about errors and issues during the overpayment process and to give a little bit of background on the overpayment process. The background was added based on some of the questions that were given, so we will go through some of those questions as we go through the different pieces of information. We are going to talk about the ways to return the money. That was a big question, and there was actually 3 or 4 different people who are like, what are the ways? How do I get you the money back? What is the best way? What's the WPS recommended way? So we'll get through all those different types. And then we're going to last talk about what do you do if you don't agree that you owe us money? So We ask you for money, but you don't agree. What are the options if you disagree? And we'll get more into all of those different parts. So we built the overview to answer the question, what is the process used for determining when an overpayment is made? This is a question that was put into the pre-submitted questions. It's one of many similar to it. So we felt like this section would hopefully help you through that process and that basic understanding. If you don't get the information within this section, some of the other information may not make sense. It might add other problems or additional questions that you have in your mind. So let's start with a basic definition. So first of all, a basic definition is that this is money owed to Medicare. The Department of Health and Human Services is the department that's over the Center for Medicare and Medicaid Services. So whenever there is money owed, the federal government does want this back. Okay. So let's begin by just talking a little bit about this. How does this happen? It is a payment exceeding the regulation and statutorily properly paid amounts. In other words, it's a debt owed to the federal government. That payment can be done in a variety of factors and for a variety of reasons. Yes, medical necessity is one of the reasons, but it is not the only reason. And so that leads us to the next question, which is what causes overpayments? Now, what was nice is I was able to build that question directly from your pre-submitted questions into this slide. So there's a couple of things that will cause overpayments listed on the slide. It's not every single reason, but it is the more common reasons. I'm just going to highlight a few of them. One, there's a processing error. Something happened, something didn't process correctly, therefore an overpayment occurred. Two, we find out the claim was incorrectly coded. This is typically done in post-payment medical review. So the claim is paid, and then we look at it post-payment. It can be done in a fraud and abuse education or fraud and abuse investigation, which would again incorporate post-payment medical review. Insufficient documentation means you can't support the claim. You can't support what was billed to Medicare in the documentation, or you simply just didn't send us the right information. Medical necessity errors. These are ones that do not support the Medicare definition of medical necessity as defined maybe in a policy, like a local coverage determination or a national coverage determination, as defined within the federal regulations somewhere. So there's a variety of things that happen with medical necessity errors. Bundling errors, this is a big one. And it's not just the National Correct Coding Initiative or this procedure bundles into this procedure for payment purposes. That's part of the National Correct Coding Initiative or PDP errors. It simply means you don't get both paid. It could also be something like the skilled nursing facility consolidated billing bundling errors, or the inpatient acute care hospital bundling errors, or the critical access hospital bundling problems. So there's a lot of factors that go into bundling. Bundling isn't one thing. Automated edits, I'm going to hold on to that one, but I do want to remind you that we do have edits that are built into both the system and the eligibility and all of that that can create an overpayment. Now we're going to hit the big two, primary payer information. In other words, there's a primary insurance to Medicare and something's wrong with the information submitted or it wasn't submitted at all. Another option with this would be when Medicare discovers that there's a primary payer, but we don't have all the information. So an investigation is open. This can stop payments from happening or create overpayments while we begin to investigate. This process is the Medicare secondary payer process under the Coordination of Benefits System, COB. So a lot's going on with that. Also, we have eligibility errors. And the reason that we built this one is because a couple of you asked about beneficiary eligibility errors or patient eligibility errors. And yes, those are one type of an eligibility error. But there are also provider eligibility errors. So for instance, the provider did not complete their revalidation, which means they no longer have an active record and they were a supervising provider for other non-physician practitioners. That creates an eligibility issue for that provider, but also for any provider they're listed as a supervising physician over in the eligibility records, all of them will be shut off. So that provider is not eligible, could also be that this patient just simply isn't eligible, or that the patient eligibility changes. Now, an eligibility issue is one that we already previously mentioned, and we'll talk more about it, but it's the Medicare Advantage plan. Once a patient becomes eligible for a Medicare Advantage plan, even if the effective date is entered and it's retroactive, we will take our money back. Okay? Which leads me to the next slide. It's called automated errors. These are automated errors done through the common working file. So these are edits. These are not something that anyone manually works or looks at. These automated errors and this automated edit system says, hey, we have something going on, and this is now going to be a take back, and the system, the common working file, which is the central communication hub for Medicare, the claims processing systems feed into it, the Medicare eligibility system under the Social Security Administration, the Medicare eligibility system under the Railroad Retirement Board, the coordination of benefits system, all of them feed into this communication, this common working file, common working file, or CWF. As they feed in, if something happens or something needs to be taken back, CWF will actually initiate a response to the Medicare administrative contractor and say, take this money back from the provider. It's called an automated. Doesn't have anything to do with you or me, right? It's an unsolicited. You will also hear it referred to as an unsolicited response. It just simply means the automated system did its job and found something that should be reported or taken back. What can cause this type of an unsolicited response? Well, first of all, the coordination of benefits system, which is where we do track the Medicare secondary payer information, or when there's someone responsible for processing a claim before Medicare. It could be another insurance, it could be a store or something like that if they were uninsured with like liability insurance as an example. So someone is responsible and has to process that claim before Medicare. It could also be a claims processing system reporting in. So let's give an example here. The Medicare Part A physical intermediary standard or shared system processes inpatient claims. However, inpatient claims are not submitted on a daily basis. They are submitted on a discharge. So if the person's in for 10 days, on the 11th day is the first day they're eligible to submit a claim, because that would be the day after the discharge occurs. So they're inpatient for 11 days, or 10 days, the day 11 after that would be the first day. They're also submitted on a monthly basis. If that is the case, they must be submitted in chronological order. So January, February, March. But January has to complete processing before February. February has to complete processing before March. If something happens, the common working file does not know they're inpatient. So you submit your physician services, you submit your lab services, you submit all that good stuff. And guess what happens? The Part A claim processes for an inpatient stay. It goes into the common working file. The common working file looks at that and says, oh, take money back on all of these Part B claims. Well, Part B claims are processed in a multi-carrier system. So it's a variety of different things that can happen there. And last but not least is the Medicare Advantage eligibility system. So when someone becomes eligible for a Part C or a Medicare Advantage plan, that eligibility will override the traditional fee-for-service Medicare, which is Part A and B. It's a replacement plan. So once that occurs and the effective date is entered into the system, the common working file, automatically sends a response saying, generate a letter and ask for the money back. Those are what we call automated overpayments. I'll talk about how to work with those overpayments should you disagree with them in a little while, but I wanted you to understand that not all overpayments are done by a human being. Now, when I say that, please keep in mind that doesn't count like medical review, where someone actually, looks at your claim, goes through medical records and makes a determination. That's not an automated process. The automated processes are the ones that no human being intervenes on. We also have patient identified overpayments. Now, a lot of people have asked questions on this one. And to summarize those questions, it's why would a patient identify an overpayment, or what can be identified by the patient? First, a patient can identify anything they want as an overpayment. We will look into it. Now, I will tell you, sometimes they identify things that are not overpayments. Let me give you an example. The patient identifies a physician who they've never seen, they have no idea. We go out and look at it and we're like, oh, they've probably never seen them because you read a test, maybe you read an x-ray. They don't even know who you are. So that's okay. That's not going to be an overpayment. On the other hand, the patient can say, I've never seen this physician. Never had this test done. I've never had any of that. And then we're going to start asking questions and we're going to start requesting records to determine whether or not you can medically support that, if the patient actually had it, all of those types of things. So it's a patient identified. These can also lead to amounts that they feel like are incorrectly paid. Many times that's not the case because it is paid based on a fee schedule, but a patient can say, hey, this was incorrectly paid. So we really don't know exactly what's going on. They could also come back and say, hey, I've seen this physician or I've seen this provider, but not for this service. That's a different type of situation. These can also lead to fraud and abuse investigations, in which case we take further action, but overpayments will result either way. So that's a patient identified. Hopefully that helps answer those questions about when a patient can, how they can. But again, remember, the patient reports this. They can report this to 1-800-Medicare. They can report this to the Office of Inspector General under a fraud and abuse hotline. So there's a variety of different ways a patient can do this. Next, there are various contractors within the Medicare system that can identify an overpayment. And each one looks at things from a different perspective sometimes. Other times, they all look at things from a medical necessity perspective, some pre and some post-pay. So a Medicare administrative contractor, that's us. We process claims for Medicare. That's what the Medicare administrative contractor's primary function is. They also do the supporting roles to process those claims, which would include medical review and writing audits and edits, things like that. So a MAC can review a claim and determine, hey, this is not to have been paid. Well, we could do that before it even gets paid and stop the payment from even going out. But once it's paid, there are times when we can do it after the fact. And that's when the overpayment occurs, okay? Now, part of that medical review is also to do the second portion, which would be if you disagree with an overpayment, you're going to file an appeal. We do level 1 appeals. That's how we fall into it. So we can take and look at medical review to make sure that overpayment should stand. There's also another contractor, and they're called the Comprehensive Error Rate Testing Contractor, or CERT contractor. This contractor only does things looking post-pay review. What they're actually looking at is to create a national paid claim error rate. Now, the paid claim error rate is exactly what it sounds like. Did we look at a claim? Did we process it correctly? Was there an error in the processing? Anything like that. To do that, they do look at the claims. They do a medical review portion. So again, they're going to request records. They're going to create overpayments should they find an error. If they don't find an error, everything's perfect and good to go. Another contractor who looks at claims is the Recovery Audit Contractor, or RAC. They do post-pay medical review, and again, they can determine that an overpayment is needed. What they do is review the medical records to make sure you support medical necessity and the level of service billed. So yes, it's a medically necessary service, but not only is it medically necessary, it was billed at the correct level of service, at the correct place of service, and all those types of things that are affecting the payment. Oops. So there's a variety of different things that the recovery audit contractor can look at. They are a targeted review, and they're looking for potential high dollar or high volumes. Now remember, where the comprehensive error rate testing program does the national paid claim error rate random sample, the recovery audit contractor, or RAC, does not. They must have the approval of CMS before reviews begins. The next one that I'd like to talk about as a contractor is the Qualified Independent Contractor, or the QUIC. So when I talked about the MAC, I said we do a level 1 review. The QUIC does a level 2 appeal review. So if an overpayment occurs, they're the same contractor that looks to say, hey, I still don't agree I owe this money. Level 1 said I do. Do you agree? That's the QUIC. They'll also, though, look at different appeals issues, and they may take money back. They may say, hey, this is overpaid based on this, this, and this. Therefore, take this amount of money back. So the QUIC can create an overpayment. Last, the Quality Improvement Organization. They review quality complaints from the patients. They review inpatient discharge when the patient does not feel they should have been discharged. So they can create different overpayments as well. All right. Of course, you can identify an overpayment. You work for a provider. Sorry, you guys, I don't know what's going on. There you go. You work for a provider, or you are the provider, and you can identify an overpayment. You can do a review and say, hey, I've got claims that were incorrectly billed, or I billed for the wrong patient, or whatever the situation is. You can identify that overpayment. The payer information, you can put information on your claim or send information to update the primary payer that can actually create overpayments, but not just for you. It could create them for all providers based on the information that is appended and the investigations and other things that do need to happen. So payer information. Also, providers, the Medicare Advantage plans. So you bill, and then all of a sudden you're like, oh, this patient has an Advantage plan, but it's not on file, so I'm just going to keep billing. You just created an overpayment. Eventually, that Advantage plan will catch up. When that Advantage plan does, we get to take our money back and say bill them for that. All right. Last one was a question that came in, so I built this slide for it. The question really was, is it just Medicare? Is it just contractors? And the answer is no. There are various parts of the federal government that can create overpayments for Medicare. Some of them are more severe than others in that they're part of an fraud and abuse investigation. Others, they're looking at certain issues. So we'll talk a little bit about these. So the first one that everyone should be aware of is the Department of Health and Human Services Office of Inspector General. So at the same level for the Center for Medicare and Medicaid Services is this Office of Inspector General. They both report to the Department of Health and Human Services. While CMS, or the Center for Medicare and Medicaid Services, runs Medicare, runs Medicaid for the federal government, the Office of Inspector General is the legal entity or the watchdog, and they want to watch for fraud and abuse and discover issues for incorrect payments. That's what they do. That's their whole job. Some people like to call them just the legal watchdog for the Department of Health and Human Services. That's fine. But they will do medical review. They can actually request that you send them records. And if you don't send them in, you will have your money taken back. We will be instructed to take your money back. This is done through an electronic feed that they give us. This one, hopefully none of you will ever get put into, but it's a Federal Bureau of Investigation. It means that you are in a fraud, waste, or abuse situation. They're doing an investigation. While they may not necessarily find a big issue with you, they may find small issues that may cost you very little money, but they're still going to tell us to take them back. Even if there isn't something where they're prosecuting you or things like that, they still did find an issue. The same thing can also happen under the Office of Inspector General. Look, it's not a really big issue, it's just a small issue, or you had this minor thing. Sometimes even like place of service can be an issue on a CMS 1500 or 837P, where it means you get less money because you billed or you were actually performing something in like a hospital versus the physician's office. So those things may not be necessarily a full out, hey, we're going to prosecute you, but they still will find smaller issues as well. Or it could be a fraud and abuse situation where they say, take all this money back, do all of this. If it progresses, it could also be a fraud investigation where you go to federal court and you're prosecuted and you're told to pay amends. In other words, you have to pay a financial difference. That's all part of the Federal Bureau of Investigation. Under the Department of Health and Human Services, they have level 4 appeals. So while CMS does level 3 and contractors do level 1 and 2, the Department of Health and Human Services actually does level 4. This is the appeals board. It is a direct part of their process. Another form or federal entity that could be involved, one, is the judicial reviews. Now, the first judicial review actually begins at level 3 appeals, and it's under the Center for Medicare and Medicaid Services, and they're administrative law judges, and they do a form of a judicial review. If you get to level 5, you'll enter into a different form of judicial review that is actually in the federal district court system, and you'll be assigned. So that's also another form of judicial review. Now, again, as I said, during a fraud and abuse investigation, there could be judicial reviews done to incorporate or to work with that fraud and abuse investigation, whatever they're doing underneath that. We're not involved in that process unless we're called to question something. So lots of different entities, but basically remember the basic thing you want to know about overpayments before I start answering a few questions is one, what is the overpayment? It is when it has been determined by you, a federal entity, or a contractor that Medicare is owed money. We are required to take money back. You are required to send the money back. Whether we have asked for it or you have determined it is up to you. But it is money that is owed to the federal government that was paid incorrectly for a variety of different reasons. Okay. So let's go ahead and answer some pre-submitted questions before we go on. So the first one that I find that I actually really liked the question, I thought it was a great question, is how old of an overpayment can CMS process? And then they had another question that was submitted about an overpayment from 2020, and could they do that? Could they also request an overpayment on a claim that's well over a year old? So again, all forms of how old can an overpayment be? And the answer is, if you discover an overpayment, it doesn't matter how old it is, the federal government expects that you will pay us back. Now, typically, we do not go back 10 years, whatever. That's not typical of WPS. Now, please note I did say WPS, we're your Medicare administrative contractor. We may go back a few years. On the other hand, there are other entities, and we talked about a couple of them, law enforcement, other things like that. They can go back a lot further. If you, on the other hand, are doing a review yourself and you discover it and it's over a year old or it's from 2020, yes, you can still refund that back to us. You can actually ask for it to be refunded. You can do whatever you need to do to get that overpayment in the system. Medicare does not have a problem with that. Medicare actually says you should do that. Next question, Medicare was billed as primary and paid. The VA should be billed primary and the VA is then billed. When is there an overpayment? Is it when the VA is billed or when the VA pays? Now, according to the technicalities here, there's a couple of things you have to be aware of. First, two federal government programs cannot pay for the same service. Did you catch the word pay for the same service? That becomes key when we answer this question, okay? So the overpayment actually occurs when the VA issues you a payment for a service Medicare has already paid. Why is that important? Because if the VA denies the service saying, hey, we don't have an authorization as an example, or for whatever reason, they're not going to make a payment, then there really is no overpayment. So you've identified that it should have been billed to the VA. You bill it to the VA and the VA comes back and says, okay, but you didn't get this authorized, we're not paying you. There's no overpayment there, even though we know that it should have been billed to the VA. Okay. Please remember the VA and Medicare are not primary secondary payers. It's an either or. If the VA pays, Medicare does not, because the VA authorizes and pays at 100%. If the VA does not pay, then Medicare will process as primary insurance. And that means deductible, copay, all of that applies, all of the benefit rules apply. Okay, so a little bit more on that if you need that, put some questions back in chat. One of the most interesting questions that I did get and comments that I did get is, why does Medicare take money back when the claim is paid 100% correctly? Well, if the claim is paid 100% correctly, no payment should be taken back unless there's an unsolicited response, which has nothing to do with how the claim paid. It might have something to do with Medicare Advantage plans being added. It might have something to do with primary insurance being added to the patient's record. While you feel like they're paid correctly, there's a portion of the Medicare program that wasn't met. That's what makes them become overpayments. Remember, we talked about those unsolicited responses. We talked about those automated responses. That's when this happens. I'm pretty sure that's the question you're asking me, but I don't really know for sure. All right, so with that said, Mary, do we have any questions in the chat?
Tom, we have no questions in chat.
Perfect. Let's move along to how do we return money? Because of course, what happens when an overpayment occurs and how do you get that money back to us? So let's talk about a little bit about the processes that go with this, because again, it does all have to be built into a certain system. So first, our overpayment process is that we identify an overpayment, or an overpayment is identified. An accounts receivable is built, which causes a recoupment request to go out. There are time frames, but if the provider responds with payment in that time frame, we will close it. If the provider requests us to begin offsetting immediately, we can do that. The provider may also do an appeal, which can hold up the recoupment, and we'll talk more about that. If, in order to close the accounts receivable, we can do an offset or we can take a payment. We can also make the appeal decision that, hey, you just don't owe us any money, process correctly in the first place. So all of this is part of the process. On the other hand, there's also a process that allows you to submit a voluntary refund, and we will automatically put it into the system to cancel the claim. It's a voluntary refund. That process begins with you submitting the refund, us then identifying the claim that it goes to, building the accounts receivable, but closing it right away because we have the payment, which automatically cancels the claim in the system. So it's a variety, a little bit of a different process. Now, the most common questions we get are not about the ones that you've identified and done the voluntary refunds on. On the other hand, the process we really do get a lot is what happens when we identify or someone else identifies, and then we have to move forward. So overpayment is identified and all this stuff is built. So once the recoupment request is built, so it's identified, the accounts receivable is built, then we do this recoupment request. Well, what is that request? It's actually a letter. It's a letter that is sent to the person who was paid for this service. That person may be you as the provider. But did you know that, let's say that you as the provider were paid correctly and the person had a lawsuit pending for an automobile accident, and that automobile accident is now done? We can actually ask for money back from that insurance, which doesn't have anything to do with you. So you get to keep a payment that you got from us as a conditional payment. So we do have to look at, hey, who actually gets this letter? So who is paid? The letter will explain the reason. Why are we asking for money back? It will tell you the amount due and contain a calculation of the amount. It will also provide you with your rights and obligations. This means, should you return the money? Should you disagree? What should you do? And a variety of other things like that. So there's a variety of factors that do go into this. It will also tell you if there are interest rates that are applicable and when they become applicable. And I'll explain that in just a moment, because we're going to get into the days that actually go with this process next. So once the letter comes out, that begins our count. What that does is gives you a day one count. This is when the overpayment letter is sent to you. Once day 15 passes, this is the last day to file a rebuttal. And a rebuttal is simply a written statement saying, I intend to do an appeal. Doesn't really do anything. If you choose not to do a rebuttal, that's okay, because you can file the appeal anyway. Then on day 16, you can begin an immediate recoupment request. So we do make sure that you want to make a time frame where you cannot do the recoupment. And it does begin on day 16. Now, an immediate recoupment request is a written request from you, the provider community or representative, for us to take the money back. Then there is day 30, and this is the last day to file an appeal to stop interest. I want to make it very clear, it's not the last day to file the appeal overall, it's just the last day to file the level 1 appeal to stop interest. So there's a big difference. You get 120 days to file the appeal, but on day 30, it'll stop the interest. On day 31, if we do not have that appeal request, interest will begin. Now, interest begins on day 31 to be assigned. If we agree with you, the interest will be waived and the amount, the accounts receivable, closed. If we don't agree with you, we will apply the interest and also open the accounts receivable and begin the offset depending on what happens. So a lot of different things begin to go back and forth. We then move on to the next set of days. And on day 40, this is your last day to pay us, and pay us in full, or we will begin an offset. Now, this does not affect interest. Even if we begin the offset on day 41 because you haven't asked us to take the money back or anything like that, you will still be assigned interest until it's fully paid back. Day 61 to 90 is your intent to refer letters. The account's not paid in full. This means that we're going to tell you, hey, we intend to do something with this delinquent account. On day 91, we do contact the delinquent accounts and we try to work with you. On day 120, it's your last day to file the redetermination, which if you notice, even though we've contacted you about delinquent accounts, we will not refer it to the US Treasury until a day 121 to 150, and that's because you have 120 days to file a disagreement, which is your redetermination request. Okay, so that's your time frames, and they all go together within all those calendar times. Okay, so once we get through all of these, what happens next? Well, of course, you can refund us. Now, a refund can be done in paper or it can be done electronically in the WPS portal. Now, again, this can also then be done in paper for an immediate offset request, which will begin on day 15, and hopefully we'll have you paid back before day 30 when you actually do owe us, when interest will begin to occur, and all of those different things, or it's hopefully paid back within the time frame so that you do have it paid back before we would refer to the other entities for legal actions. There's a lot of different things. The Treasury would be an example. Okay, so you can also wait and let an offset occur. But again, remember, offsets don't begin until day 41. So you want to make sure you have everything in place. All right, so let me just show you a couple of things real quick with this. Now, we always tell everyone that when you're looking at this, the best way to use it is the electronic system, which is the WPS portal. That is on our website, and it's right here on the top. It's this login section. And inside the login section, and again, I'm just going to go back to the main page. You can see it's still there. If I flip down and say, hey, I want to look at overpayments, you can see it's still there. So there's a variety of different ways to do that. I will always recommend checking out the portal user manual. And when you scroll through the portal user manual, you're going to look for a section under transactions, okay, overpayment adjustments, all of those, and that's where you're going to look for it. You can also file an appeal. This is an appeal submission indicator as well, so you can do that here. So there's a variety of things that can happen inside this. When you want to file the refund itself, you can actually file the refund here. You can search for an overpayment here. So again, refund, file it, refund, search. I'm not really sure exactly what the person was looking for, so I'm kind of just hitting all those different sections up there. Let's go back out for a second. What we're going to do is we're going to go back to the topic center and we're going to go back to overpayments, because right here, and this is one of the areas that is frequently missed, you'll see guides and resources, news and updates, FAQs, and forms. This is under the header information and it's in a little green bar. It's kind of, it looks like a square. But if you go to forms, we actually do have different things like the immediate recoupment form, the overpayment notification form request, redetermination of an overpayment, all of those different things are here. I do want to point out this extended repayment schedule, though we haven't got that far yet, we will talk about that. Same thing if we flip it to Part A, again, line of business, UB04, 837I, line of business 1500, 837P, so make sure that you're on the right area. Iowa, Kansas, Missouri, Nebraska is J5. J8 is Indiana and Michigan. If you are one of our national providers, you will fall into J5A. But you can, again, see that you have the different forms here and you can do whatever you need to do there. Okay. So if you're doing any of those, please feel free to look at that. Please make sure that you're doing the appeal if you need to do that. Extended repayment schedules is next. Now, the reason that I built this in is because we had a provider that asked a question and said, we can't financially afford at this point to send the money back. What do we do? And the answer is you file for an extended repayment schedule. So first of all, let me tell you, this is not an appeal. This is not that you disagree that you owe the money. That's not the case, even in the least. What this is is saying, I know I owe the money, but if I try to pay it within 30 days, it's going to cause me a financial hardship and I can't do that. So I need more time to pay it. The extended repayment schedule does not stop interest from occurring. It does, on the other hand, help you understand what you need to do to make sure this is done. And you typically have 36 months to repay it. Now, if you are in more of a need or you need a longer period of time, we do have to go to CMS and ask if you can take that period of time. So it's a little bit different than just, hey, I need 24 months or hey, I need 30 months. Those we don't have to look for CMS approval. If you're asking for longer than 36 months, we do. But the extended repayment schedule will just help you really look up the information that you need. It's going to help you with the forms and all of that type of information. I do think this is an important aspect to keep aware of if you need it. If you need it, you don't want to put yourself in financial difficulty. So please make sure you're using this when you need it. Okay, that's going to bring me to the next set of questions and answers, and I'm just going to go ahead and go through the pre-submitted questions. How do you submit the overpayment? I'm going to go back to SNAP for this one because I do think it's very important that you actually see this. Now, again, SNAP is the SecureNet Access Portal. Right here, you're going to go back to the portal user manual. You're going to scroll down and tell me which action you want. Are you actually trying to do a refund? Then you're going to select that. Are you trying to do an overpayment? What are you looking for? But let's just say we're trying to submit the refund itself. It will actually walk you step by step through how to do the refund, how to complete this form, what you need to know, all of the different pieces of information. I think this portal user manual is a great place to start. If you do have questions beyond this portal user manual or something isn't working, you do need to contact customer service. What is the best way to do a refund to avoid paying a penalty? I really don't know the best way. I can tell you from our refund department, we do like the electronic refunds done in SNAP. And the reason that we like those is that it does allow us to use automations and to make things go a little smoother. It allows our system to work more efficiently. So of course, that's going to be our preference. Doesn't mean you couldn't do it in a different way. Here's the key thing. You have 30 days to get this in. If you do, that's important. Also, you have 30 days to file, which we'll talk about in the disagree section. If you want to file and you want to stop the interest from, stop the overpayment from applying. The next question we got is, again, can we let the overpayment be recouped automatically? Now, again, the recoup is simply when we just start taking the money back, and the answer is, it is not your best option. Again, it is not your best option. However, yes, you can do this. We will not begin this until day 41. So see that time frame chart that I had before, and that's when we will start the recoupment. So why is it not your best option? Well, you could actually have written to us on day 15 and said, get this started and get this done so that no interest applies. Interest has been applying by the time the automated recoupment happens for 11 days. Because remember, it doesn't start until day 41. Interest started applying on day 31, or 10 days, I guess. So why is it not your best option? It's going to cost you more money to sit and wait rather than have us get started right away if that's the option you choose. So again, just your options though. Let me check with Mary real quick. Do we have any questions?
We do not.
Okay. Let's jump back to the slide deck just for a little while here, because the next set of information is, what do you do if you disagree? Now, there are a variety of actions that can be taken, but ultimately, if you don't agree with the overpayment, you have to look at the overpayment. I will tell you, we get a lot of requests where they don't agree with the overpayment, but they're saying something about the claim. The claim processing is not what you disagreed with. It's the overpayment, and we're going to talk more about that. So please make sure that when you're addressing anything about an overpayment, it is about the overpayment and not about the claim itself. Okay? The rebuttal. So a rebuttal is just very simply a written statement. There's not a whole lot that goes into a rebuttal, and it's a written statement. It's due 15 days. You want to provide evidence, but this doesn't stop interest. This is not part of the appeals process. This just simply says, I intend to file an appeal. I intend to not let you take this money back. A couple people asked, is the rebuttal necessary? Is it a requirement? And the answer is no. The rebuttal is not the necessary portion. It's not a required item. So the RAC discussion period. Now, this is specifically built in when the recovery audit contractor or the RAC has an error. What your goal is to have them remove the error entirely without having to file the appeal. So the discussion period is allowed anytime you disagree with the recovery audit finding. Now they're going to send you a letter before the overpayment letter is issued. Once the overpayment letter is issued, you can't do the RAC discussion period because it has to be based on their letter. If you disagree with their finding, inside their letter, you'll have 30 days to file for a RAC discussion period. The discussion period is just information and it's to support the evidence. Why do you disagree? Can you talk to someone about it? Sure you can. You can actually ask to speak to someone on it, which is their medical director. So it's a little bit of a different process and it's only for those recovery audit information. I do recommend that if you're interested in the RAC discussion period, go to the CMS website, go to the recovery audit program webpage and look up the discussion period. So that means that you're going to come to the website, it's cms.gov. I like to just simply type RAC discussion. Make sure you type it correctly, which I did not, but RAC discussion. And then you're going to look at some of the different options within it. Here you can see the RAC overpayment determination, discussion period, rebuttal, etc. So if I go to this page, it'll talk about what option should I use, which one is best. So this is just a little flow chart. I like the flow chart. You may not. If you want to get more information, come down and look at the different web pages that are available to you. Now, someone asked if we have information on the RAC discussion period on our website, and we do not. We're not involved in this, so it's not something that we have any information on at all. But I wanted you guys to at least be aware of the RAC discussion period and then to give you a reference in case you should happen to choose to use that. Again, what's nice about the discussion period is an accounts receivable never opens, nothing ever happens in terms of the MAC, in terms of us taking your money back, if you do get the discussion period in your favor. All right, so what happens once you have an overpayment? Well, that's what the next couple of slides are going to talk about. And first of all, the overpayment process is the same as the claims overpayment process, except you are the claims appeals process, except you're not filing on a claim, you're filing on an overpayment. And that is probably what you need to be aware of the most. Because if the request comes in and says, hey, I disagree with how you decided this claim, we will look at the original determination date on the claim and we may dismiss it timely filing. On the other hand, if you're saying, I disagree that I owe you money on the overpayment of this claim, we can now look at the overpayment to determine whether or not that claim or whether or not that overpayment should stand. So it really is about disputing the overpayment. It is the same 5 levels of appeal, beginning with the redetermination, and it has the same time frames. Nothing changes about that. So I'm not sure where people felt like that change occurred. It doesn't change. In other words, the first level of appeal, which is a redetermination, has to be filed within 120 days to the Medicare administrative contractor. Not sure what else you're looking for with that. Oops. Sorry, again, here we go. The reconsideration, the Office of Medicare Hearings and Appeals, all of that. So if you look at the booklet that I provided you, you're going to see a lot of information, and the booklet will use the term Medicare claims. That's fine. Just replace that word and put overpayment. Now, it is the same process. Everything is done the same. We were asked about the Departmental Appeal Board, and is there a time frame for them to file theirs or to complete theirs? And yes, it's 90 days. We were also asked about level 5, and is there a time frame for the federal district court to repeat their or to complete their review? And the answer is no. You're put onto the federal district court docket. whether they require you to come in person or whether they require you to do a phone visit or a teleconference visit or whatever they're going to do, that's all on the federal district court. We don't have any control over that, and no, there isn't a set time frame to complete it. But for most of the other 4, it's 90 days to have those completed. After your appeal, whatever level you're at, you will receive a couple of different pieces of information. First, if we uphold our decision at any level, Medicare that is, if Medicare upholds the decision, you will receive a letter. The letter will then explain your appeal rights for the next level, unless you're at the judicial review, which is the 5th level, because there's no more appeal rights. Okay. That letter also then tells you why we made the decision that we did, whatever that is. Okay. If, on the other hand, we overturn the decision, you will get a new remittance advice, possibly with a new code and all that type of thing, can actually issue you new appeal rights on that denial code should we deny for whatever reason coming next. So there's a variety of different things that can happen with that. One of the questions that I did get in is, why do I get a letter and a new remittance advice? My understanding is that I got one. The answer probably is you had what is called a partial overturn. In other words, a portion of it, of that claim information, was put back through the system and processed, while also a portion stood, it was upheld. So we have to tell you both situations, right? Here's what we did with the new portion, the part that we're reprocessing, but also here's what we did with the uphold. So you get both. So don't be confused that happens. It does happen from time to time. Okay. Now, there is a special process just for overpayments when you file the appeal. Now, again, this is only going to apply to overpayments, and it's called 30 days to stop the recoupment. What it does is it stops the recoupment until a decision is made on a level 1 and a level 2. So if you file within 30 days of the claim determination on a level 1 appeal, we will not start the recoupment at 41 days. We will wait until that's done. We'll also give you an additional 30 days afterwards to file to level 2 before we begin the recoupment, even if we uphold our own decision. And that's because if you happen to file within that time frame, we will not take money back. Okay. So basically what the goal is just to stop the take back in case we agree with you. We should overturn it. Well, then why would we want to take your money back just to simply have to reissue you the money? That's what this process is. Some people here referred to as a 935 process. That's just the portion of the law that it's covered in. Nothing major. Please don't get hung up on that. 935 doesn't mean anything other than a portion of the law that it's covered. Now, one of the key things, and again, I want to remind you, and I said this before, it does not stop interest. It doesn't stop interest. It does not affect your standard appeal timeframes. So while you still have 120 days to file level 1, it does stop and say, oh, we're not going to complete this, or we're not going to take money back until after we make a decision on level 1 and 2. All right, let's get through some of these last question and answers, and then we'll go from there. So levels of appeal, we were informed in an audit that the certification and recertification was incorrect because the doctor didn't date it. This is a huge thing. It has to be dated and signed. Many times that dating leads to a time frame. Okay, so yes, it has to be dated and signed. When you go to do the appeal on this, can it be upheld? And the answer is yes, it can be, because we found the error. So now when you go back and you have the doctor do all these things and you think you're doing the right thing, what can actually happen is it may appear to be a fraud and abuse situation. Hey, we found the error, now you're fixing it. Now, if you had done that beforehand, it would be a completely different set of things. If you disagree, start moving through your appeals process. Utilize that appeals process. Otherwise, pay us back. Next question. When Medicare is secondary and overpay copay amounts on the primary insurance, what do we do? So let me tell you that this was submitted from someone who bills on a 1500 claim form or an 837P, and I'm going to tell you that there is a formula. That formula does allow Medicare to pay more than the copay from the primary insurance. What it doesn't allow is for an additional payment to be to the patient or from you. So you can't bill the patient for things. So it's not necessarily wrong, and please check out the information within the Internet Only Manual and then our Medicare Secondary Payer Calculator on our website if you think it might be wrong. You can also call and ask customer service questions, and they'll help you to do it. I wasn't really sure what the person was looking with how to file an appeal other than to file it the same way you would for any given claim. It's the same process. You can use our portal. You can file it in writing. If you file it in writing, we do have an optional letterhead that you can use, or I'm sorry, cover letter that you can use. That information or that form will then indicate that it's related to an overpayment, which is the best way to indicate to us not to take that money back for 30 days. So I will always, again, tell you the best way to file happens to be using the system, though. Use the electronic system when possible. I was asked the best way to contact the overpayment or refund department. The best way is to start with customer service. You can write into them, which will be handled at a different level than if you call into them. Obviously, the person on the phone can't be taking written and trying to do that, but also then handling the inquiries coming in on the phone. So that's why we have different people doing different staff in there. But that is the best, that is the only starting place. We were asked what happens if we have multiple overpayments or a large number of overpayments and you find them on an internal audit. If they are the same issue, you can request them via written and include a list of all of them, and we'll take a look at that. Again, the best way though is to go into the system and enter them one-on-one to make sure they get entered correctly. I was asked about forwarding balances. So a forward balance is on a remittance advice. And what a forward balance is used for is to say, hey, there was a portion applied today to an overpayment, except it's not filled. It's not done. There's still additional money. And that forward balance is then put on there saying you still owe X amount of dollars. You do have to go back and research. Where is the overpayment originally? You should have gotten a letter explaining all of that, and you should keep those letters and track to see if it's closed. Because the forward balance won't say, hey, you owe this amount on this overpayment, whatever. You can call customer service and they can look it up, but it's not written that way. It's just a forward balance. How much do you still owe us? Can a forward balance involve more than one accounts receivable? Yes. If you owe us for more than one accounts receivable and they are currently actively being recouped, yes, it can. We work oldest to newest. How do we deal with credits due to Medicare reprocessing? If it's an overpayment amount and you find that you have a credit and you owe it to Medicare, you can refund us that. Okay. Part B, corrected claims and overpayments. I'm not sure what we're getting at here. The only way to correct a claim in the Part B system, which again would be an 837P or 1500 claim, would be to use the clerical error reopening. Once you've done that, the system may process the claim differently based on the information that you've entered, and this can create an overpayment. If that happens, we will open an accounts receivable and we will ask for the money back. If, on the other hand, you're doing an audit, you are welcome to file those back into us with a form out there that is available to you. So I'm not really sure what you're looking for there. On Part A, if you're trying to correct a claim, remember this is our 837P, 837Is or UB04s. Use direct data entry. It's the best way to correct your claim. But in either case, you still owe us the money. It's just how you get that money back to us. There was a question on CR 13818. This is a very specific set of information. If you do not think we are processing claims according to this CR, contact customer service. They must do a full review. Okay, I'm not going to stop again for questions because I don't have time. I'm going to go ahead and go on. Want to make everyone aware that as of August 4th, we are changing our customer service program. We're going to allow one NPI PTAN combination per call. So if there is more than one PTAN associated with that, you must call in again. Again, this is on August 4th. So please make sure that you're aware of that change and what can happen with that. I asked Mary to put some more information into the chat for you just so that you have it. The information will be a link to an article on our website. Next, you will receive an email shortly after this. It's going to have a certificate of achievement. The certificate of achievement has contact hours. The contact hours are what translate to CEUs. We do not offer CEUs. That's by a different governing body, whoever's going to give you them. The contact hours is what you'll need, so keep the email. Also in the email, you will see on it's highlighted in the top box and it says provide feedback. This is because we want to hear what you have to say. We want your feedback. So with that said, we do want to let you know that follow-up questions can be taken for the next 7 days. In the subject line, please put Overpayments webinar. Overpayments webinar just indicates that it should come to me to be followed up on. And we'll take those for 7 days. Again, the email and all that's provided. We would like to hear your opinion. We want to hear what you think. And that's done via the survey. Give you a couple of options already, but there's a chat link. You can take it right now. Gave you the option that would come in the email. Another option that will happen with a live event is a pop-up box that will occur once I close this. Here it is. Here's the external set. This is what it's going to look like. But I also am going to give you an opportunity if you take it in Encore, and it's going to be via this picture. It's going to look like online survey with the 5 stars checked. So you can give us your feedback. Tell us whatever you want to tell us. What could I do better? What could WPS do better? Anything like that. So a couple of people asked me, what do we do with this feedback? And the answer is we do changes. So for instance, WPS has added chapters to our YouTube and training indicators. Those are 2 of the biggest changes. We are currently looking at our training center based on your feedback. What can we change? So again, we do hear you. We do take advantage of that survey comments and those questions and this information that you put in there. And that brings us to the end. So thanks for listening today. We do appreciate your time. Again, I really encourage you to take that survey and give us that feedback. Remember, we want good and bad feedback. It's not just all about one or the other. Please incorporate any topics related or unrelated to overpayments into that survey as well. On behalf of myself, Mary, all of Provider Outreach Education and WPS, thanks for participating. You may now disconnect. Have a great day, everyone.